Well, welcome back, everyone. Today we are joined by Dr. Pamela Gardner from the Lima Memorial Heart and Vascular Institute to discuss receiving prompt medical attention for congestive heart failure. So thank you so much for joining us here, Dr. Gardner.
Good morning, my pleasure.
All right. Well, to begin, why is it critical to address congestive heart failure as soon as possible?
Heart failure is actually a chronic condition, but there can be exacerbations where someone's doing well, and then for some reason something goes off the rails and they start to accumulate fluid. They feel very short of breath. They have trouble lying flat. These would be the symptoms that they're starting to experience. Their legs are now swollen, their belly's tight. And when you get to that point, you may be taking your meds as you're supposed to be. Sometimes that's an issue. We'll talk about that. But your gut is swollen as well as your legs. And so now you can't absorb your medication. So all the treatment that your physician has prescribed isn't getting to your kidney to get the fluid out. Other things that begin to happen is the kidneys start to deteriorate in how they can function. They're overwhelmed. And so we need to get the fluid off in a safe and appropriate manner. So addressing this before it becomes a drastic problem is super important.
Yeah, you just mentioned symptoms. I think that's so important. So can you just reiterate what specific symptoms or signs should prompt individuals to seek medical attention?
Okay, so things that people will begin to notice is they normally can lie pretty flat or only need one or two pillows. Now they need to be propped up. They can only sleep in their recliner. They can't lie down because they can't breathe. Their weight will go up. My heart failure patients, I want them weighing themselves every day and watching for increase in the weight overnight. Our weight should go down at night, not go up. They should be letting me know if their legs are more swollen. Some people will have distension in their belly. They'll feel that. They just feel really short of breath. They can't breathe. Usually not chest pain necessarily. That adds another layer of problem. But the things that I watch for are those that I just mentioned. Your weight going up, your legs swollen, you can't lie down flat. That means your heart failure is getting worse, and we need to be aggressively addressing that.
Wow, okay, that's always good to know. Now, how can a same-day appointment help with addressing potential congestive heart failure concerns?
So either here in the office or in my heart failure recovery clinic, people can call and we will have them come in, look at what's going on, look at their medicines, get some blood work, see what their kidneys are doing, because I have to be very careful about not breaking something while I'm fixing something else. And then change the medicines up. Sometimes they even need to be admitted to the hospital for intravenous medications. That said, in the heart failure recovery clinic, we can give them IV Lasix or Bumex as a one-time shot right now. The other thing that we have been able to utilize is a particular kind of Lasix that's in a delivery device similar to what diabetics use. They tape this thing on their belly, and over 5 hours it will deliver a Lasix dosage so that they can diurese at home. So knowing up front what's going on and who is going to need these types of therapies is important. So getting them in early so we can begin working on what's going to be best for you. I have a few people who are admitted for 6-hour infusions of medications twice a week in order to get them more what I call euvolemic, their volume status, where it needs to be, and keep it there.
Yeah, so for anybody that wants to make a same-day cardiology appointment, the number is on the screen. It's 419-224-5915. Dr. Pamela Gardner, I want to appreciate you so much for giving your wealth of knowledge to all of us and our viewers today. I appreciate that.
Thank you. It's been my pleasure.
All right, well, don't go away because we have more when we return.